Hey there, my name is Cloud, and this is me enjoying my runs and the best gifts of life with my ladies. You can say I'm passionate about running. Welcome to my channel dedicated to recovery and rehabilitation. Thank you for joining me in this journey to recover from the big C and hopefully someday soon run again. Hello, another day, another grind. Let's do this. Let's get after this. You and me on this journey, road to recovery and rehabilitation. Hopefully, running. For today, still working on this very simple program. Cross train, rather, between um, these four machines. I'm hoping by next week I will have the wind to actually make it 3 sets. But to be honest with you, even the 2 sets this week, by the end of this does kind of give me some fatigue. So anyways, still at it, still working on my wind, on myself. This is probably my third or my fourth session for this week. So I'm hoping that you are tagging along and you're also working on yourself, working on your own rehab program for your own recovery, be it from a lung cancer or from surgery or whatever condition you are battling and fighting. I just want you to know that you're not alone. Somewhere out there, there's this me going through this fight and this journey to recover, to get better, to get stronger, to get my life back, get my quality of life back. So, anyways, for today, I wanted to share with you quite a few things I've noticed with regards to my chemo port, something very specific to it. And if you've been following my channel, you may have noticed me sometimes throughout my sessions in my workouts in my training program, gently rubbing or touching my left upper chest or right over my left shoulder. That's where my chemo port is. I think I'll take a picture of it and just kind of quickly show you what it looks like here. But for today, I just kind of really want to highlight to you some things that I've noticed with regards to my chemo port. First of all, what is a chemo port? Well, a chemo port is a device that they surgically implant into you. The doctor makes a cut on your skin, usually around your chest area, and then there is a small puck, I want to call it. It's almost like a small puck like device that has a long tube. The puck like device is essentially where they would inject your IV fusion for your chemotherapy, and then the long tail or small tube that goes with it is and inserted into your veins, to your great veins, your vena cava, they call it, that goes straight to your heart. So I suppose the genius of it is to allow quick access and immediate access to your, to get your meds, your IV meds, your chemo meds into your system without overly using your veins in your arms, in your left arm or your right arm. Because trust me, throughout this process of cancer, chemo, and all of these tests, surgeries, and everything, you're going to get a ton of blood draws, like a lot of them. You're going to get multiple blood draws multiple times a month. And if they're just using one particular vein from one arm, it will get overused. So I suppose the whole premise is to use the chemo port for your for the bulk of your treatments when they are infusing you with intravenous chemo meds. I'll show you a picture of what my surgical scar looks like, and what the chemo port looks like on my chest here. Um, Anyhow, what I've learned, and what I've noticed with my chemo port, and I've had it as of today exactly um, exactly 10 weeks. 10 weeks since it was surgically installed onto my upper chest by the same doctor who actually performed my lobectomy. I went back to him so he could install the chemo port. So 10 weeks, and the first thing that I noticed and I want to share with you is that the bulge is noticeable. Wearing shirts or whatever, you could tell that there really is a chemo port installed on your chest, because it makes a big bulge. I mean, I want to define big. It's something that's really palpable that you can see. It's not easily hidden when you're wearing a shirt or a polo shirt. In my case, it does stand out. You could really tell that it's there. So visually, when somebody looks at you or when you are looking at the mirror, you could tell it's really there. So the first thing I noticed, perhaps it's the location of where it's been installed, but it's really visible. So that's the first thing. The second thing I want to say is that the puck itself, it's not sensitive. I mean, you can touch it, you can rub against it, you could feel it. It's not pain, it's not tender, but you could really feel that it's there. It's just that the surgical scar, though, the part where they cut into you to slide the puck inside, that's the part that's really sensitive for me. It's in fact, it's hypersensitive. If a seat belt, it rubs against it, I don't want to say it's pain, but you can really tell it's uncomfortable. I'll say it's uncomfortable. It itches often. It's tender very often, and when I sleep, and I'm a side sleeper, by the way, and that's the side that I sleep on as well. I could really tell when I lay on it, on that side, on the left side. So, some little niggles that really remind me that, hey, there's this thing over there, that you could really tell. Again, the pain is not severe. It's by no means that it is. I'm not saying that it is. It's just something to be aware of. The other thing that I want to share with you is the fact that I do have lifting restrictions. I cannot lift. The doctor discourages me from lifting anything more than 20 pounds, really, overhead. So having said that, it does limit how much lifting, pulling, tugging that I do, to the point that I don't even attempt to do push-ups. Whereas in the past, I love, if it's not obvious, I do enjoy working out. And one of the things that I used to enjoy doing is doing pull-ups and push-ups, which I'm not doing right now, as you can tell from my program. Doctor says no. And in the trials that I've done, no, I could really tell. So no, so it does affect that. So the chemo port, whereas it does offer some unique advantages, as part of your treatment regimen for chemotherapy, there are certain distinct disadvantages. How long will I keep mine on is the question now. Since I'm no longer going to do chemotherapy, how long should I keep mine on? Well, the doctor says not to take it off yet. Give it a few more months, possibly 2 or 3 more months. Um, Depending on when I actually start my elective, my targeted therapy treatments, they'll start to run some more labs, and then we'll figure it out at that point, but not before yet, not before then. So officially, I'm not doing any more chemo therapies, but the chemo port itself, the doctor thinks we should take it at some point down the road. Mm, so that's kind of where I'm at right now. Um, I'm curious to know where you're at. If you have a chemo port, how has it been for you? Do share. What's worked for you. But again, the pain is there. It's tolerable. I don't necessarily want to rub more stuff on me. I'm curious to know though. What about you? What's been working for you? Do share. Please tell me in the comments below. I'd love to get your perspective on it. So as of today, this is where I'm at, continuing the grind for rehab and recovery. Thanks for joining me in today's session. Wherever you are, however you're doing, know that we're in this together. Have a great day. I'll see you soon, or I'll talk to you soon. Bye.